And there's always certain treatments, which I hate doing certain treatment. I hate tilt tabling people, and Karen will say,
no, I think
I think we should really try and tilt table this patient. I'm like, but we'll tilt table them, and then I'll say, yeah, that was a good shout.
So why don't you like it?
I just don't like the process of doing it. I find it very passive.
I mean, I'm not the greatest fan.
No.
However, I feel that there are a group of patients, and often
there is a place for it, and research shows there's a place for it as well. I do know that. I just have this mental block about the sort of strapping somebody to a table and standing them up. It just seems so.
What's the point?
Yeah.
So what is the clinical point for the patients that you're selecting it for?
It helps with tone.
Tone is the main
Tone is a big thing. It also does, I mean, even with spinal patients that we know have had spinal injuries, they will stand them every day because it does help with bladder and bowel. It helps with your vascular system, so it helps with blood pressure and blood pressure control. It does help. It's a massive thing for tone. So it helps to increase tone for patients that are low tone, decrease tone for patients that are high toned. It stretches. We can stretch in their bed, but we're not going to stretch them as well as standing them up on their feet. So there are, especially with your types of patients, there are reasons why we should be tilt tabling them. But it's not great. You don't feel like
patients hate it as well.
Yeah, the patients
really
and they
feel, if they are slightly away.
Yeah.
You always know the patient's hating
their
it.
blood pressure and heart rate will go up.
They'll cry.
Don't like
They'll be agitated.
And my argument is sometimes they'll be, because it isn't comfortable and it is giving their TAs a proper stretch, and so therefore it isn't nice. So, but to stop them from getting contractures, we have to.
It does feel like the worst thing we do to a patient.
I don't like it.
You think, I hate doing this to patients.